For our next guest, because you all know going to the doctor for a checkup makes us all very, very nervous. And today we have a respected physician and a very kind man who I couldn't be prouder of, here to tell us what you should watch out for when it comes to your health. Please welcome my brother, Dr. Kevin Hunt. My brother Kevin's a doctor. I used to be a nurse. We used to work together in the same emergency room. Yeah, many years ago. So we've shared a lot and been through a lot together, which has been my honor because I've learned so much from you. So it's so exciting to have you on my talk show as our doctor. Well, what?
The question that I had for you was, why would you want an expert like me when you can call Mom and ask Alice?
It's true. God
knows all about the medicine.
I know. It's actually when Kevin gets sick, he's a doctor. He still calls my mom.
You know, I call my mom. Mentholatum, gargle with salt water, a little bit of garlic.
Yeah,
so thanks, Mom. I'll tell my patients the same thing.
Yeah, the cure for everything. But tell the audience, because, you know, on a very serious note, we lost Dad at such a young age. My father died of a heart attack, and it was devastating and changed all of our lives because he was only 53 years old. And that's why it's so important for people to get checkups, right, Kev?
Right, exactly. Yeah, I think that the most important thing now that everybody is honing in on is health promotion and disease prevention. Used to be that you go to a doctor and the doctor would tell you, okay, you're sick, take this medicine. But nowadays what you really do is you go to your doctor, and the doctor, you want to develop a relationship with your doctor, and the doctor right away says, well, what kind of risk factors do you have, and how can I help you to get through your life before disease occurs? So that's what I like to do with my patients. They come in, I do what's called a biopsychosocial approach, where you not only look at their medical problems, we look at their social problems too, because a lot of times patients come in and it's really stress that's bothering them. Or
you mean social problems like?
You know, occupation. I mean, right now in the economic environment, patients are coming in with a lot of physical problems, but really what they stem from is that there's so much stress going on, and you want to try to modify that by telling them, listen, you know, I understand what you're going through. Maybe we can help you by giving you a little bit of short-term counseling, things like that.
Yeah, and when you go to your doctor, you always say this to all of us in the family, write down all of your questions before you go.
Right. That's what you got to do, is you write down your 2 or 3 most important questions. Because you go to a doctor, the first thing I always hear is, I forgot what I was going to ask you.
Yeah, because you only have that window with the doctor
for a certain time. Right, exactly. And you know what? When you're in with a doctor, most of the time now, like when I'm in with the patient, I'm just looking at them and I'm trying to assess them. I'm not thinking about anything else. So you're getting that time with the doctor. You want to make the most of it.
How do you know if your doctor is the right one for you?
I think that the first thing is that you listen to a doctor that listens to you, and a doctor that communicates to you and looks and talks to you eye to eye, and really has eye to eye contact.
Right.
And then you want to feel like you're part of a team. You're not feeling like somebody's domineering over you. Your doctor is telling you what to do, but you're actually involved in the care.
Mm-hmm. I know you're going to answer questions from the audience, but I do want you to talk for a minute about Uganda.
Yeah.
Tell the audience a little bit about going out there. I know we have some footage of you.
I met this priest at our church, St. Ida in Chicago, and it's really emotional, but he told me, he says, do you want to go to Africa with me? And I'm like, I have 3 kids and a family. I can't go to Africa. And he says, we're going in August. And all of a sudden I told my wife, who's a nurse, I says, do you think I should go? And she says, whatever, follow your passion. So I went, and we went to several different health clinics in the area, and a hospital, a Bear Hospital in Uganda.
And you saw a lot of the women that were having children.
A lot of women that were pregnant with malaria, having children with fevers, chills, lying on a cement floor. And I thought, we got to do something. So what we did is we actually went and bought beds for this one health clinic, loaded them on a pickup truck, and brought them 50 miles to this place. And people were so excited. And this one lady that was pregnant just delivered that day.
Yeah, and look at how beautiful.
Yeah, she delivered her baby that day, and we were able to get her in a bed. And she said, what's your daughter's name? I said, Alexandra. And she says, you know what? I'm going to name my daughter Alexandra. I'm like, whoa.
Yeah.
Mm-hmm.
And I know they can go to your website. What's the website for the?
It's MANU Giving. .org.
Yeah, there it is, and you can see Kevin in the photographs from Africa and the change that they're going to make now in bringing medical care to the people there. Okay, up next, my brother's going to answer some health-related questions from our audience. We'll be right back with Dr. Hunt.
Up next, Dr. Hunt takes questions from the audience.
What's the single most important thing a person can do to improve his or her health?